And liberals always tell me people aren't smart enough
Right.
to buy their own health insurance.
Right.
How do you answer that question?
Yeah, well, Switzerland shows they are smart enough. They do a darn good job of it. But the real answer to that question is in every market, most of the people are very dumb. Most of the people who buy computers are dumbbells. Most of the people who buy cars have no idea how a car works. What's critical, nevertheless, we buy good computers and good cars. What's critical is that we have good information so that the people who are smart can read that information and the rest of us will follow them. And it is, again, 80-20. If 20% of a market is smart, all the rest of us, the dumbbells like me, are going to follow along with them. Now, is 20% of the American public sufficiently interested in healthcare to make the rest of us smart? Healthcare just crossed pornography as the #1 visited site on the internet. So about 40 to 60% of the American public is looking at healthcare information. Who's looking? Smart, all kinds of people, but primarily highly educated, very wealthy people. Is that good or bad? Well, to me, as an economist, that's terrific. Those highly educated, wealthy people are the sort of assertive, obnoxious people who keep picking at suppliers and making them better and cheaper. This question is a non-question.
You advocate that employers provide a selection of healthcare plans. However, as someone who runs a small business, we find it's not cost effective. How will your solution help us?
Right. My solution is to take the employer out of the business of providing health insurance. That is really my ultimate goal. And rather than forcing the employer to buy health insurance, provide a selection of plans, all these onerous things. My husband owns a small business. He knows virtually as much about health insurance as I do. That is ridiculous. There is no reason he should do this. A consumer-driven system would be driven primarily by consumers and would get the employers out of the middle.
And the question that has been asked the most, I think I just counted 6 of them. You recommend an individual mandate, yet mandates have been a fiscal disaster in Massachusetts. How would we avoid that as a country?
Okay. So I am not a person who thinks of government as a solution. I am a person who thinks of government as a problem. So the idea of mandates is anathema to me. What we can learn from Massachusetts, where the marketplace in Massachusetts affects only 300,000 people, we cannot learn much from it because, unlike Switzerland, it's not a national market. It's a little market in a state that has 7 million people. But a really powerful negative lesson is when the Massachusetts legislature designs health insurance policies, they are going to be Mercedes-Benzes. Every benefit in the world is included in this insurance policy. If you think about the U.S. Congress designing cars, I guarantee you that every car would come with a heated seat, because your little tushy is going to freeze in the Minneapolis climate. Now, you might say, you know, the $2,000 for that heated seat, I would rather spend it someplace else and wear 2 pairs of underwear. I can deal with this in a different way, but you won't have that option. That's the real lesson from Massachusetts. So why do we need an individual mandate? Here's the problem. If you want health insurance to cover the sick, right? That is what health insurance is about. The sick spend all the money in the healthcare system. So we can have health insurance for the healthy without a mandate because it'll be dirt cheap, be very inexpensive. But the people who are sick will not be able to afford health insurance. So that will be a travesty. So how do we cover the sick? We can put them into what's called high-risk pools, which are insurance pools that are run by the state. No state can afford to cover sick people. There are 400,000 sick people in high-risk pools. There are 60 million sick people in the United States. That's a joke. We can tax the healthy to pay for the sick, and these proposals to tax health insurance, for example, are a way of taxing healthy people to pay for sick people. The problem with that is if you tax the health insurance of sick people, they're going to stop buying health insurance, so you exacerbate the problem. By this tedious reasoning, I have reached the conclusion that the only way to make sure that the sick are covered is to force everybody to buy health insurance, and in that way, the healthy 80% will cover the sick 20%. I don't see any alternative, and I hate the conclusion. The protection would be that it would be a consumer-driven market where people buy for themselves. But if we don't force all the healthy to buy health insurance, we won't have any way of covering the sick people. What the heck are we trying to do?